certain medications are being administered to the systemic circulation through intravenous route. Now we have medications ordered by the doctor that are being given or to be given IV injection or infusion, meaning they are being given directly into the vein of the patient using a needle such as this one. There is actually a thin plastic tube called your IV catheter or IV cannula inserted to the vein of the patient. These will allow multiple doses of medication being administered. Now, there are two kinds of IV administration. The standard IV catheter or cannula is used for this purpose. You have first your IV push or an IV push or bolus is a rapid injection of a medication. A syringe is inserted into the catheter to quickly send a one-time dose of drug into the patient's bloodstream. Next is the IV infusion. Your IV infusion is controlled administration of medication into the bloodstream over time. For this demo, we will administer the medication into the catheter by gravity in the absence of a pump. So we refer to this as a drip infusion method, which uses gravity to deliver a constant amount of medication with a drip. The medication and solution drip from a bag or bottle of NSS such as this one, okay, then a tube into your catheter. Example of drugs given intravenously are as follows. You have chemotherapy drugs, antibiotics, antifungal drugs, immunoglobulin medications, your pain relief medications, drugs for lowering your blood pressure such as dopamine, epinephrine, norepinephrine, and dobutamine. In this demo, our concentration will be on antibiotics. How to prepare antibiotics intravenously and administer them IV push or via infusion using the Solucet. Question: is IV medication use safe? Generally, IV medication use is safe. It can cause, however, both mild and dangerous side effects. There are medications that act on the body very quickly, so side effects, allergic reactions, and other effects can typically harm the patient. There are 5 stages of the medication process. The first stage, we have ordering and prescribing. This is where we check the doctor's order in the physician's order sheet. And where can you find that? Of course, in the patient's chart. Okay. We have the transcribing and verifying. We are to check the cardex where the medication was transcribed. So, in the patient's chart, okay, we will look for the physician's order sheet. So, this is what your physician order sheet looks like. So, the doctor will write in here, give, for example, Cipifim, okay, 500 milligram IV every 12 hours. After the doctor has written the order, okay, the nurses usually prescribe it in the cardex. Okay, in this part, medication. So before you give your medication, you also have to check not only the physician's order sheet, but your cardex. Next is your dispensing and delivery. Was the right drug dispensed in the nurse's station, or did the nurse receive the right drug? Check if there was failure to transcribe the doctor's or the physician's order. And then the next stage is your administering. This is the most important part, no? Okay, as one of the top responsibilities of the nurse is to administer medication. So this is where your rights of medication administration comes in. Is it the right drug ordered by the physician? Is it the right dose? No? Was the right amount of medication for injection prepared? Or this is also the time we're in, you have to check, is the medication given on the right time, the right route, or was it regulated at the right rate? For cipifim, for example, it is given via infusion, okay, to run for 30 minutes. So we will calculate that later on.